Welcome to the 946th day of continuous and uninterrupted Zoom session of IFPH. Let us start today's program with a silent prayer for a minute. Thank you. Today our guest is Dr.P.S Nithya, BHMS, MA Psychology, PG in Counseling, Kerala University, Trainer NLP, Medical Officer, Ayush Primary Health Center, Marannallur, Trivandrum, Kerala, India. Nodal Officer, OPPM Project, Consultant Counselor, PDC, Adolescent Mental Health. Took more than 200 public awareness classes on various subjects, more than 20 years of experience. And the topic is Intercurrents in Homeopathy. It's quite interesting and important. So on behalf of IFPH, I welcome Dr. Nithya. I think our guest is not yet joined. Maybe due to some technical problems or due to the busy practice. We all know that a lot of barriers has to be crossed by each and every person in order to attend this prestigious program on time. Because we all know that a lot of time limitations, so many constraints are there. A seamless entry of this program is not an easy affair. Everybody knows that. And regarding this intercurrent medicine, we all know that the importance of intercurrents. You can see a lot of references in the organ of medicine where Hahnemann often advises to give a small dose of axomica or sulfur in between or reparsel, mercurius. A lot of medicines were described by Master Samuel Hahnemann. Yes, our honorable guest Dr. Nithya joined. Yes, Dr. Nithya, we have already completed the formalities. Once again, welcome you. You can on the platform for the next 45 minutes or two. Please start. Please unmute. You are muted. Please unmute.
Whether I'm audible?
Yes, of course.
Okay,
please.
okay, sir. Okay. So, can I start the class?
Yes, surely.
Okay, warm good evening to all of you. I think I was just late for about 5 to 3 minutes. Okay. Today my presentation is on intercurrent remedies. I think almost all doctors are aware of this intercurrent remedies. But why I am focusing on this intercurrent remedies because before starting the intercurrent remedies, let me say 2-3 words. That is, whether the medicine or the intercurrent remedy or whatever we give to the patient, that is the second point. That is, if a patient enters our consulting room, the first thing the patient is we should understand what the patient is expecting from us, not accepting, expecting from us. That's a question. Why? Because if a patient is entering the doctor's room, if you see the doctor, the facial expression or the attitude of the doctor is sitting in an attitude of low confidence. I don't think that if whatever medicine we give, I don't think we'll reach a success point. That is very important question. Why? Because the attitude of the doctor or the mental status of the doctor, the confidence point of the doctor surely will affect the healing process of the patient sitting in front of us. I think we all doctors are very much confident. We all have a lot of knowledge in materia medica and all that. But for sitting confidently in front of the patient, we should be aware of what all things are going around in the society. Why? Because if a patient is coming to us, whatever be the system, whether homeopathy, allopathy, or whatever system we are following, the patient feels that if the patient is not in the promising hands of a doctor, I don't think we'll start the process of healing. That is very important. Why? Because let us see, if a patient goes to the other system, such as allopathy system, what we watch is that entering inside the allopathy hospital itself make the patient more confident. Why? Because first of all, they are monitoring the vitals. So not even touching the patient and sitting and we are talking to the patient, we are taking the case again and again, we're repetizing it, what all process going on. That will not convince the patient, because touch is very important in the case of doctor-patient relationship. Either we take the BP or we do, at least we just palpate the pulse. That all things give more and more confidence to the patient. On that base, we'll start with the intercurrent remedy. That is why we should focus on these intercurrent remedies. We all know the materia medica of almost all drugs. We know Natramur, we know Pulsarla, we know Sepia, we know acid force, Staphysagrine, all we know. But why I focused on this intercurrent? Because I got a case recently. I will first explain the case, and then we'll go to this comparison of this intercurrent remedies, what all will come. So a lady came to me, and she told me, what she told me was that she and her husband came to me for the first sitting. And what the husband told me is that this lady is very troublesome in the house. She's simply quarreling. She's making problems. So what the husband told is that within the 6 months, they changed the servant. It is a seventh servant now within the 6 months. She's just quarreling with the servants. And what happened is that she's simply saying that somebody is knocking at my door. Somebody is knocking at my window. Such that way she's saying again and again. She's searching all the house whole and making the servants to search the whole house. So that was the case. And what she was doing is that she's an entrepreneur, and she's very succeeding woman in the business job. And what the husband told is that she's a very brilliant businessman. And after she entered into the business, that the business became a great success. But the problem is that the family, she is not giving any calmness to the husband or the children. That is the problem. They can't sleep. She's simply quarreling with the kids. She's simply quarreling with the husband. No peace of mind in the family. And what they said is that they visited almost all the psychiatrists. What she told was that she visited the famous psychiatrists such as Arun B. Nair, and a lot of psychiatrists and psychologists and homeo doctors also. So when she when she presented the case, what she told was, doctor, I visited that homeo doctor, that famous homeo doctor. I didn't get any, I didn't get any calmness of mind from after consulting the doctor. I'm not getting any peace of mind. So what should I do? And I took the case. And when I took the case, what the lady, I asked the lady whether she's having any problem inside the family, whether the husband is hurting her anyway, or the children is making any problem. She said, no, doctor, they are not creating any problem. So I said, you come alone. I don't want the presence of your husband. You just come alone. Next visit, you just come alone. So I took the case. And what she told was that at first she pretended to me that she's a very bold lady. She appears to me as if she's a platina. That is a very arrogant lady, always shouting to the those who are working under her. She's simply shouting. And she had kids. And what not kids, grown-up children. And what I asked about them, and also she said, I don't know, doctor, I'm just quarreling with them. I don't know what's my problem. I'm just quarreling. After taking the case, after making a good rapport with her, a good friend of her, she started opening up the case. I was just shocked to hear that. Why? Because I saw a small child in her, a pitiful small child who is just crying in front of me, just like a kid, and she started lying on the table. So I took the case, and what she told was that it was very shocking. And what she said was that her case history was that what she told, first she told and cried was that, doctor, my husband is having a secret relationship with my staff. I know everything. But for the goodness of my kids and my family, I'm not revealing to anyone. I am just closing my eyes. First of all, I thought, she's laxist. Whether she's suspicious and telling this type of suspicious stories. That was my first thought came to my mind. But what I did is that I just asked her to give the son's phone number, and I inquired to the boy. I asked him, and not boy, he's about 18 years. And I asked the boy, what is the problem? Is it true? What is happening inside? And the boy said, madam, what she is telling is right. My mama is a very poor lady. But the problem is that now she's very irritating and very irritable. So she's quarreling, she's throwing things. She what she always says that somebody is knocking the door, somebody is knocking the door. So I went through the almost all the materia medicas and what is having this type of this symptom. So that made me go into this intercurrent remedies, and it worked very well. I took the case. I asked the lady, you have any case records or something? Just she said, yes, doctor, I have a case record from a government hospital. I said, show me the report. Show me the medicines what you have taken. I just went through the list, and what I found was that she had taken almost all the materia medica drugs from different doctors. She took the Natramor, and she took what I found is that she took Ignatia, she took Naxomica, and somebody has given a lot of, and somebody has tried this batch flowers also. And what she told is that, doctor, you see this? One doctor told me to keep this in my hand and drop 5 drops morning, 5 drops at night. Whenever I got this tension, when I become angry, you just drop this 5 drops and drink it. I took the medicine, and what I found, it was Limulus. And she have in her bag a lot of this type of remedies, batch flower remedies. A lot of batch flower remedies are there, and she's having mayapple or something just like that. And after so I understood that I should go deep, and after studying only I can give the medicine. A lot of medicines come to my mind, which are the irritable medicines and are outbursting medicines. There comes the intercurrent remedy. If doctors, you can give any suggestion of this case, please say the medicine. If you got any case, the presentation is that she's having an outburst. And what she is throwing things. She is abusing the kids. She is saying bad words. She knows she do this at this moment, and next moment itself she's repenting. So that was the case, and that was the presentation. So let me say one more case history of her. What she told was that she had a case history back when she was in her younger days. What happened is that her father was her stepfather, and at her younger days, what happened is that she was being physically abused, and she was being physically abused. From that onwards, she have this feeling that somebody is knocking the door, and that was the case presentation. And another case sister, what she told was that she actually her desire was that to take the degree course, and she wanted to have some love relationship, some boys, and she desires to have she desires to have a relationship in her younger days itself. Okay, and that was the presentation. And what happened is that what the parents were doing is that they don't want the girl to take this degree and to join a normal college, and they want her to take a professional course. So what happened is she was paid a payment seat, and she was being qualified from an engineering college, and what happened is she failed. She didn't get the certificate yet. And after that, she went into the business field, and whatever they succeeded economically. So that was the case. So if doctors, you have any suggestions, you can give the drug. If you're getting some medicines coming to the mind, you can give suggestions. And we'll go to the discussion. We'll say the medicine, we'll go to the medicines. So let us discuss which all medicines come to this point. So I just inquired, I just went through the list of drugs that she had taken. And in that list, it was given, Staphysagrine was given. I said almost all the drugs had been tried, and that was the case presentation. So let me say, if you have any suggestions, you can give, or I will say what drug I gave and how it worked out. So the drug which I gave was carcinosin. Why carcinosin? That is the second point of discussion. Let us discuss the other drugs. Let us think of this. So before going to this medicine discussion, let us first discuss what is this intercurrent remedy. Whether our forefathers have discussed about this intercurrent remedies. Who all said about this intercurrent remedies? There comes the importance of this intercurrent remedy. So intercurrent remedy, what it means is that it is a remedy that will corrects the blocks, the miasmatic blocks which are there will be corrected to a long extent by this intercurrent remedy. If we are selecting the drug, the correct supplement drug, or if the drug is acting in a halfway and it will come to standstill, it's not processing forward. So these intercurrent remedies will make the transport very easy. There comes the importance of these intercurrent remedies. We have a lot of intercurrent remedies that we usually misses. So in this case of this lady is obese, very obese lady. And so what she said was, doctor, I was a lean person, but I became obese some years back only. Okay, that was the case. And she had PCOD and a lot of symptoms. So the drug of comparison comes here was, first of all, I thought of this thyroidinum, because thyroidinum is also a drug which is coming very close to this. But the difference what we see is on the physical level, thyroidinum suits this situation. Why? Because obese. And another thing what we found is that what she told was that I can't adjust with my family. I can't adjust with my kids. I can't adjust with my husband. I can't adjust in my office. That was a presenting symptom. So this thyroidinum came to my mind. But what pulled me back is that this thyroidinum, I just want to know, this thyroidinum is a drug that is having this type of maladjustments. But thyroidinum is a drug that is having usually causes maladjustment is coming because of the endogenous cause. That means internal cause. That is hormonal cause. So this is not the hormonal cause. Why she has having this problem is that she went through such a lot of traumas. And I asked the lady, and what the lady told is that, doctor, I know my husband is having this type of relation with that lady. I know everything. I got all the proofs. I just will show you what he's talking. I asked her where you got this type of messages and all that, where you got this audio clippings, and what she told me was that, doctor, you don't know. What I did is that I just made an app into my husband's phone, and I am just taking the call recordings. I just put the call recordings and he went off and he started talking. And when I heard about their talk, if we are in that position, we'll kill that man. That such type of talk is going on between them. She knows everything. And I asked, why you should stick on to this? I asked whether he's the earning member. No, he's not the earning member, madam. He doesn't know how to earn money, or he is not the earning member of the family. What I am holding the family. I am struggling. I am making money for the whole family. Then I asked, then why should you struggle this much for by holding this type of toxic person? And why should you go on to this type of toxic relation? And what she told was, doctor, you know one thing, my mother remarried a second man and he abused me. And I went through a lot of traumas with my stepfather. So he was just acting in front of me. I even just also, I didn't reveal it to my mother. I can't reveal it to mother because I will lose the family. I want to show the whole people that I have a family. So I doesn't want to break my family. Also, my children will struggle if they don't have a father. So I'm holding on this, holding the family. I said, whether you revealed it to your husband. No, ma'am, I didn't reveal to my husband. I said, why you reveal? Don't reveal. No, I don't want to break up the family. There comes the importance of carcinosin. So how carcinosin becomes important here? Because carcinosin is a person, it is just like that. They will hold everything inside. Let us compare the two, three drugs. Let us compare the natramur. How the natramur will respond to the situation. Natramur will express the irritability. If a person do like this to a natramur, what the natramur do is that natramur will show the irritability or grudge. They will surely show it or express it. They will hold it, but they will express it. Then let's compare the next Staphysagria. How Staphy will respond to the situation. How Staphy respond is that if the Staphy is on the first stage, they'll be a sweet person, so they won't respond or they won't react at all in the first stage. So they will hold it inside and they won't express it at all. That is a Staphy. We won't get it from the Staphy, but Staphy will become wild Staphy. We just go through Philippum Bailey. In that, it is there. They have given how a sweet Staphy will become a wild Staphy. That is, they will go on to the second phase. So how they respond, the Staphy will respond is that they will respond with outburst of anger. So they will respond outburst of anger. So but Staphy will stop it with maximum. They will go to throwing up of things. That is just like Naxomic, throw up things. they will stop by there. But carcinosin won't stop up just like that. What the carcinosin is, they will break everything. They will express their rebellious anger. The carcinosin also will go through 2-3 phases. How it go through different phases. In the first phase of carcinosin, what they do is that they will hold everything. They will swallow everything. They will chew everything. They won't express. They won't tell anyone. They won't reveal their friends. Nobody even knows that she's having such a big problem. Also, what is the difference between staphy and carcinosin? Let us differentiate. That is, staphy is also having these type of mental struggles, and again they will be having staphy, will be having these type of struggles. That is on different ages. If you take the case of staphy, they will share with us a lot of traumatic stories that staphy will express. Same also carcinosin will express. I was being abused at this age, and I got this type of trauma from my husband at this year, and I got this from this year, and everything will be holding inside. So at last, what happened? Outburst. The cell can't hold it. The extreme suppression. It will outburst in a rebellious way. So, but again itself, it is expressing rebellious way also. They won't say what is happening inside the family. They won't reveal. Such a holding. Why? Because they want to hold the family. So that was the main red line symptom I got from this lady. That is, she doesn't want to break the family again itself. She wants her husband to be there. She is feeding the husband, giving everything to the husband, and that there comes the importance. There comes the difference of this carcinosin. So this carcinosin is another thing. What the carcinosin is, striking symptom that we can notice that we have a lot of anxious remedies. We have asal, we have a lot sulfur. Sulfur is very anxious remedy that we often, sulfur has got a lot of mental symptoms that we think of sulfur only as a dirty, filthy sulfur. No, that's not sulfur. Sulfur is having a variant of mental symptoms, and it's also in intercurrent, can be used as intercurrent. Sulfur is a very suspicious person. We think of lactoses as something as less suspicious. This sulfur is also a very self-oriented, selfish person, very extremely selfish person. They take care of him only. So sulfur also come to this scenario also. But this carcinosin, how the next the very important thing that comes to the point of carcinosin is that anxious. Anxiety is extreme for this carcinosin patient. How anxious? For what anxious? Anxious for everything. That is the case. Usually get some person, some ladies will come and say, doctor, I am very tension. I got a case 1 week back. A lady came to me from a doctor from here only. And the lady said the same symptom. Doctor, I'm very anxious. So here, this case, first case I told, there also this anxiety is very prominent. How much anxious? What she said is that I feel as if somebody is knocking the door. So this, if a lady narrate the symptoms just like that, somebody, if they feel like somebody knocking the door, you just think of it that she may went through an extreme mental trauma. Usually, maybe about 70% may be sexual abuse. That is very, very striking symptom. And why I asked the lady, whom you are afraid of, who may be knocking at the door, is it robbers? She said, no, doctor, I am afraid that somebody will enter my room when I am sleeping. She is putting all the knocks and everything. All windows are being locked, putting the AC inside, and she is staying inside. She is very much afraid that somebody is knocking the door. I asked, what is your insecurity feeling? Whether it's robbers or what you're thinking of. And what she said is that, doctor, I am afraid that somebody will abuse me when I'm sleeping. She's about 48 years. Who will come and abuse her at this 48-year robust lady? I saw that there's no chance, but she's thinking just like that. So this is a case where I gave this lady carcinosin. I gave this lady carcinosin, and what happened is that the climax was a little bad because she started revolting against her husband. That was the first symptom I got it. So I understood the medicine was correct. And she, after giving this carcinosin, what happened is that they will stand up for their own rights. They will start talking for their own rights. And what she said was that, doctor, what I said was that I told my husband, I can't hold this long. If you want to go to that lady, you go with that lady. Or if you're coming and staying with you just come back. And what happened is that outpouring of her emotions started. And what happened? She started revolting. She stood for her rights. There was some quarrel and was some quarrel summons. And also, but what happened finally is that she's happy now and going on smoothly. She can do her work. She is coming back. And what happened is her weight loss was very striking. About 5-6 kgs she lost weight, and she's coming back to her normal life. And what my success was that from this case, I got a lot of cases just like these cases. That is, she has some connection with the Kerala Industrial Development Corporation, and from the KIDS, Kerala Industrial Development Corporation, I got a lot of entrepreneurs and lot of cases from this field. Why? Because there. But my struggle and my pain is that this is not coming out. Nothing is coming out. We are doing a lot of things, but nothing is coming out. That is my sad story. Anyway, whether it's coming out or not, the case succeeded. There comes the importance of this intercurrent remedy. So, so what is the time now, sir? Sir, time?
8:26.
Okay, so there is no time for some other. I have one more case, but there's no time for a second case presentation. But I will just.
Yes, you can take another 15-20 minutes, no problem.
15 minutes, okay. Okay, then we'll go to another one case where these similar intercurrent work very nicely. I will present the case. So this is a case where again this is a case of a PCOD case. PCOD case, and what happened is that this lady came to me. This girl, not lady. This is not an aged person, aged lady. She's a girl around 26 of years, and that was the case came to me for the counseling only. And what happened is that and the boy was why she came, because that case came to me because when I entered the driving practice and the driving school owner was the case, and he was not an old person or an old male. He's about 30 years only, 32 years. And what he told me was that, doctor, my wife is simply creating problem inside my family. She's not adjusting with anyone. She's quarreling with my sister. My sister is a very lovable person, and she's simply quarreling with my sister. She's simply quarreling with my mother and my father. She's creating a lot of problems. I don't know what to do. What happened is that since she's creating a lot of problems, I am taking her to my driving school and making her sit in the driving school with me, because so that she may not quarrel in the house. But what happened is that when he came to the this driving school, what happened is that she's quarreling with the girl sitting there and making problems. Also, she's here making problems with the customers coming. So what should I do, doctor? Where should I keep this girl? I love her, but what happens? She's such a problem maker. What can I do? So here the boy was sitting and crying in front of me. He said, nuisance. I don't know what to do, doctor. If any person is in my position, surely will go for divorce. But I'm not going for the divorce. So I asked to bring the girl. And what the girl said is that, doctor, we have been married for about 3 years, 4 years. We have no kids. We went for a treatment for this, for getting a child. We went for treatment for some doctor at the City Hospital, General Hospital or something just like that. We took a lot of treatments and all that. So I'm not conceiving, doctor. I know what's the problem. What I mean is, my husband is having no love with me. He's just having love with the parents only. He's not caring me. She's blaming a lot of things and such that. So I took the case. And what she told was that I asked, when did this problem start? So the girl said this, doctor, I was an athlete and I was very interested in sports. What my parents did was that they indulged me into the marriage. So when I came to the marriage, all my sports future failed. So I'm being locked inside the house. So I'm struggling, doctor. I can't adjust with anything. And what she said was, doctor, so I took the case. What is your puberty? Did you have your menses and all that? And what she said was, doctor, you know one thing, before 3 to 4 days of menses, I will make these problems a lot. So I asked my husband, don't talk to me for the before menses 5 to 6 days. But the problem is that my menses is irregular. So the husband said, doctor, her menses is irregular. So I don't know when the menses will come. So how can I hold these 5 days? How can I predict which 5 days I should not talk to her? She's always quarreling the whole month. So that was the case presentation. So I asked the girl, did you have your menses when did you have your menses? So she said, doctor, I have menses in my younger days. And from that itself, there's a lot of problems, doctor. My menses may be irregular, or sometimes maybe 2 times a month. And she said a lot of things just like that. And after my marriage also, I had a lot of problems. I have menstrual irregularities and all that. I don't know, doctor. So I said, did you check your thyroid? She said, yes, doctor, I checked my thyroid. And I said, what was the rate of it? And what found was that the T3, T4, T3 rate was about, the TSH level was about 2 points. So I asked her to go for a scan, thyroid scan. So inside thyroid scan, it was found that nodules are there. 2-3 nodules are there. And so I just want to find out what is the cause. So I just inquired the family background and everything. And what I found was that there is an exogenous cause is there. That means nothing from outside. Family is okay, parents are okay, everything is okay, but she can't enjoy. And what the girl said was that at last she agreed, doctor, I am simply creating problems. I don't know what is happening in me. I'm always in irritable mood. And the girl is emaciated also. And so I asked her, when you have this problem, I have the problem just before the menses. I just gave her a used abdomen. And what found was that she's having PCOD. And so what I got was that she was emaciated, and all these cases, 2-3 drugs came to my mind. So I first gave the medicine which first came to my mind was Natramur. And Natramur, this type of irritability and all that. And what made me pull to Natramur is that because this Natramur is having this type of irritability in a greater degree, and they will swallow it inside. They don't express the anger. So that made me think of Natramur. But okay, somewhat gone on, and nothing appeared so positively. So what happened is that next I went to the drug, and I revived all her symptoms and went to the drug, and I gave her thyroid in a 10 1 dose. So what the miracle appeared was that within 18 days she conceived. And what she's carrying a baby, about 6 months baby. She's pregnant now and she's carrying. So that why I will just discuss the drugs that come to the series. Natramur is a drug that come to the series. Iodine is there. And what made me think of this thyroidinum is that no cause is there. If there is an exciting cause from outside, and if they are responding to that stimuli, we can think of the Natramur, taffy, carcinosin, tuberculinum, and all that. But there's no such cause, no such or exciting causes there. So there comes the importance of this thyroidinum, where no adjustment at all, no adjustment capacity in both mental, physical, and so also this thyroidinum has a lot of symptoms that make us think of this thyroidinum. That is palpitation, vitals are excited. You just think of this thyroidinum patient. What happened is that BP will be excited, and what happened is that for this girl, what happened is that she's having this menstrual irregularities and all that. And what made me think of this thyroidinum, the striking point is that one is this PCOD, and the mental level, vitals are excited. And what the girl said is that, doctor, I want to go to sports once again. And what the husband told me is that, but why I'm not letting her go is that, doctor, she's after running for about 100 meters, she's palpating just like a dog. So how can she have palpitation just like a dog? So how can I let her go to the sports? That is second indication. Vitals are excited, palpitation, pulse, go to the pulse. Then also thyroid, hyper and hypo, both of them. This thyroidinum is a super drug. And anyway, thyroidinum was given and the girl conceived. So that was the case. So this is second intercurrent remedy success story. So I think it's time for discussion. Is it?
Yes, anyway, if you want to continue, you can continue for another 10
Okay.
minutes. Otherwise, we can have discussion.
Okay. We'll do. So in if we are going through this type of intercurrents, what happened is that probably the girls told if you're going through this mental symptoms. So I went through the mental symptoms of the girl. What the girl told was that, doctor, I have a lot of depressions. Doctor, I am simply sitting and crying. I have a lot of depression. So if this thyroidinum, the main indications of thyroidinum is that it's having symptoms on the mental plane. Along with that, it's having a lot of physical symptoms. Physical symptoms that we usually misses. That is, if a person coming with the if you are going through the thyroidinum patient, what we see is that you go through from the menstrual history itself. That is first menses itself. We are just going through the case. What we see is that first menses itself, they'll be having you had a menses. From the second menses, there'll be problems. No reason or cause is there. From there, if they are going through the next phase, entering the next phase, that is from the puberty phase to entering to the menstrual phase, what happens is that there may be severe menorrhagia. Severe menorrhagia is thyroidinum is a very good drug. We'll go through the pulsatile and macros and everything just like that, but thyroidinum is a very good drug for this menorrhagia. Menstrual irregularities, those who are having 2 times menses and just like that. For that, all indications, this thyroidinum is a very good drug. Next phase, go through the lady third phase. That is, if the girl is going to the, the people are going through the girls and boys are going through a lot of hotel foods and junk foods. So what happened is a lot of hormonal changes are going inside the body. So what happened? There may be more probability for PCOD. For PCOD, thyroidinum is a super drug. If you think of PCOD, in our mind, drugs come is calcareous carb, graphitis, and all that. No, but other than calcareous and graphitis, a person is having emaciated child and she's having menstrual irregularities. If we check she's having PCOD, and if you go through the history of the family and we find no cause at all. And there also this thyroidinum suits very nicely. Next phase of a child, next phase of the women, the child conceived, the lady conceived. You just go through the pregnancy history. What happened is that at the time of pregnancy, they'll be having edemas all over the body. We have a lot of drug for edemas. No, we have calicarbs, we have natrums. Lycopodium is also a drug that's having edema that we usually misses, and APIs that all have drugs with edemas. But along with this thyroidinum is a very good drug for this edema. Edema at the time of pregnancy. Then, if a girl is normal up to the time of pregnancy, after pregnancy, we can find after the pregnancy, we will find a lot of physical symptoms. What all that? Toxemia of pregnancy, hypertension of pregnancy, diabetes at the time of pregnancy, hypotension at the time of pregnancy. These all time, this thyroidinum suits very nicely. Next, after that, we are going to the next phase of a lady. It's a super lady drug that we usually misses. We usually uses it properly. We'll go to the sepias, pulsatlas, natrimols, and all that. But this thyroidinum usually misses it because other than the mental symptoms, a lot of physical symptoms. Because for a homeopathic practitioner who are interested in earning money a lot, just focus on this thyroidinum and carcinosin. We can earn a lot with this drug. Why? Because almost all the ladies are going through these thyroidinum phases. And after this time of pregnancy, what happened is that going through after sweeping to the age of 40 or 45, she will sweep on to depression. She will sweep on to the suspiciousness, depression, and all type of mental symptoms. That is, and the girls who may come and complain to us, that is premenstrual stress or premenstrual tension. For that premenstrual syndromes, thyroidinum is a super drug. That is soreness of the breast just before menses, weightness of the body. That is the body will feel heaviness or water filling tendency after the menses, sagging, everything. Thyroidinum is a super drug. And these all symptoms we can use thyroidinum in a very good. Thyroidinum is a very performing drug. And also for the some ladies will come and say, doctor, I think it's just like a common word now. Earlier we didn't have any word like stress or tension is a word that is very common now only. Earlier it was not said commonly like that. This type of people, that is after 40 syndrome, that's a new name of a syndrome, after 40 syndrome for ladies. For that, thyroidinum super action drug. Why? Because simply become angry, simply become anxious, feeling as if something bad is going to happen. And for that, all type of mental symptoms, also muscle flabbiness, sagging of the breast, muscle flabbiness and all that. This thyroidinum is a very brilliant drug. So I think if you want to focus on more, if you're applying for an economical hike, thyroidinum is a very super medicine for these ladies who are coming to us. For emaciation also, thyroidinum is a very good drug. Okay. So go through this thyroidinum can be used in both mental, physical, muscular level, vital level, and all that levels. Thyroidinum acts very nicely. Also, we only think of this thyroid lactases as a drug for this menopausal symptoms. That is for burning of the body and all that type of hormonal withdrawal symptoms. We usually think of this lactases and all that. But for that case itself, this thyroidinum is a super drug. Use it maximum. Go through a research through thyroidinum. We can get a lot of medicinal action in this thyroidinum. It's a super drug. So I think it's time to wind up and see. Other than thyroidinum, we have a lot of intercurrent. I just throw 2 drugs, 2 intercurrents. So if you have any discussion, you can.
Yes, doctor. Yes, we can continue in the next coming days because the intercurrents is very much needed. Otherwise, we can say the interlocutor is also needed in case of this family affairs. So time for discussion. Those who would like to participate, please go to the participant list and raise your hands. Important topic. We all know that the relevance of this intercurrent remedies that is mentioned by Dr. Samuel Henneman, none other than in the Havers under 83 in the footnote. Opium is mentioned. Well, it is followed by Stuart Close mentioned some other medicines, the chapter posology. There you can see carbohydrate, laurocerus, sulfur, and thuja are the medicines suggested by
Bonnie Hassan.
Yes, you can see it is mentioned by Bonnie Hassan as well as Stuart Close in the genus homeopathy. So then there are other medicines which can reduce the hyperactivity of the body, just like Naxomica, so many medicines are there. So these are the definitely advantages of this homeopathy therapeutic system. This makes homeopathy the rational system of medicine. But what happens is that, as you just mentioned, we don't have such formalities and such establishment to convince the patient. What is needed. If there are enough built infrastructure, definitely it will attract the patient. You just said about the entrepreneurship. Yes, that way every homeopathist should learn the art of entrepreneurship. That is most important.
Yes, sure.
We are hearing a lot of wonderful treatment histories, treatment cases, stories in this platform. But we have failed to convert it into dollars or rupees. That is what that should be needed in this case of this medical science. I think a couple of questions here in the chat box. Carcinosin with potency.
What I gave was what I got from it maximum symbolism. So I gave her carcinosin 10.
Yes. Okay. Then another question is thyroiditis. Potency, thyroidinum.
Yes. I think she asked thyroidinum. Again, I gave thyroidinum 1.
Yes.
Thyroidinum 1.
That's another thing. Then regarding the suggestions by Stuart Close, he suggests that medicines as nosodes are very important.
Very important.
Yes. Sorinum, syphilinum, medornum, tuberculinum must be remembered in this condition. So what is needed is a thorough reading of the basics of homeopathy. Just a couple of days back, Dr. Srinivasan presented a wonderful topic. I think Dr. Nithya was missing that. I'm not sure whether she was there or not. She is only participating in these presentations, I think. So that is the most important. The observations after the administration of medicine is very important. Then also, Dr. suggests another important point is that there are certain diet and regimen problems are there. That will also deflect current, as said by H.A. Roberts. You can see a chapter in H.A. Roberts textbook, deflect current. What it is? These type of hindrances. So what is needed is a seamless journey of a homeopathy medicine. So the homeopathy physician should well aware what are the things that will hinder the process of cure. It may be the potency, the attenuation, the repetition, or the diet, the regimen, or some other medicines, or the emotional reasons. So there, the point of this counseling or some sort of solace in terms of words and deeds is needed from the part of homeopathy physician. Then only he becomes a physician. What is your opinion, Dr. Nithya? I think there are anybody would like to participate, Dr. Tanesh? Yes.
Good evening all, and good evening, Dr. Nithya. It's really a wonderful session for me once again, because nobody really think that what is the relevance of this kind of intercurrent remedies. But frankly speaking, there are just like some mediators, whenever there are issues, somebody needs some mediators. Just like these intercurrents works like in that way, in a beautiful way. To complete the cure, or to accelerate the cure, or sometimes to modify the cure. Am I right, Dr. Nithya?
Yes, sir. Susceptibility. Yes. Susceptibility is another main point that we should focus. Susceptibility of the patient. Why? Because we are going through susceptibility is very, very, very low in almost all cases. So susceptibility is a point that is discussed by H.A. Roberts.
Exactly.
Okay.
Actually, what is lacking among our doctors is that nobody is reading all these philosophies, but everybody is concentrating more on materia. But only when we read both together, then only we will be able to get a good result in the shortest possible time, as rightly you point out here. And the cases you demonstrated here are also really excellent. And nobody could believe that such cases can be cured with homeopathic medicine. Because a lot of cases are coming where you can use thyroid in different potencies. You can usually you can start from the basic potency 3x, 6x, then 6, 200, 1. I used different kind of potencies, but in most commonly, I used to give 3x and 6x in the beginning session. But gradually, I may raise to this as a higher as to 1 potency when it is supposed to act as an intercurrent. What's your opinion on that? Whether you should go with the low potency or high potency, we prefer for this being used when it being used as an intercurrent. Do you hear me or not? I think
yes, sir, I can hear it.
Yes. What's your opinion on that? Whether when you
are no, I'm not clear, sir.
When we are giving this thyroidinum as an intercurrent, which potency you prefer? Whether you prefer 30th potency or 1 potency?
If you are getting the mental symptoms more prominently, we can use high potencies. Yes. But if the physical symptoms are more prominent, we can switch on to this 6x and 3x and all that. And after all, what all Dr. Manoj sir said is exactly right. Right? Because for homeopathy, just don't focus. Homeopathy is something must be precious to the patients, must not be revealed and must not be given in a simple. It's not an easy thing to get. Like that should be the focus of the doctor. Why? Because if you're giving that's having some, I think it's some business mind. It should be necessary itself. Why? Because If a patient is coming and they're taking, doctor, I'm taking this thyroidinum. If you're asking the patient to stop the drug, what we should insist is that we should you take this thyroidinum 3x. You just break it up and take this thyroidinum 3x. Don't worry, no problem at all. We can bring it under control. And after giving thyroidinum 3x, what we should suggest is that you should take the tablet only after taking the tea. And without taking the tea, nothing may happen. But why we are suggesting that is because we should make the point. If we can't catch the subconscious mind of a patient, whatever drug we drink, it is in vain. It won't work at all. That's what I felt in my version. That is, if you're giving a drug and don't give the some doctors, what I see is that they will give a lot of tablets and all that. No, give only counting tablets. After 10 days, the tablet should finish. And the 11th day, the patient should come. That should be our focus. Just like that, we give the medicine. If you are getting cetirizine at 10 rupees, and if you're getting another drug, which is getting 100 rupees per one tablet, will we leave the tablets? No, we'll take it preciously. Just like that, we should just for the practice of we should fix the rate of the consultation little bit high. That is very necessary. Why? Because if a patient goes to allopathy hospital, one sitting itself, they are paying about 2,000. Without 2,000 or 1,500, they can't leave the hospital. So just like that, for thyroidinum, if you're giving this, like you give thyroidinum 3x or 6x. With physical symptoms, we give thyroidinum 3x and take it in the morning. After take tea only, give that suggestion. So it will become a precious drug.
This is what I used to do, because I used to say to the people that you should take a packet of powder. That's most probably placebos. As soon as you wake up, just take some 2 glasses of water and then you take the powder, which is usually placebo. But then ask the patient to take the thyroidinum 3x soon after 7 a.m. and as well as 7 p.m. I just give 2 doses, 7 a.m. and as well as 7 p.m. and 2 tablets each, 3 grade tablets. Definitely, that really gives an impression on the patient that something is working with this medicine. And today also I got a patient, she was having a severe pain all over the body. But the thing is that she used to have insulted. She has just going through her, just completed her hysterectomy some 1 year back, and still there is problems with her. The cause behind these things is that the husband is a person who is very suspicious about her, because she's a beautiful woman, and he's just a local man, and he is not as beautiful as her. So he's suspicious about her. So usually every day there will be problem in the home, and this may be the reason why she suffered this fibroid uterus, and all those things end up with the hysterectomy. But even after that, her thyroid problems are increasing, and whenever there is issues, she gets severe pain in her hands. Then suddenly the BP may shoot up and everything may rise up. So in those conditions, I used to ask her to take this thyroidinum 3x 2 to 3 times a day. This is the method, and this is the method I used to handle the case. Anyway,
Okay.
I'm very happy to come to you, Dr. Nithya, for this wonderful session in this evening. Thank you.
Yes, in the last day, I think Dr. Ismail sir, somebody mentioned about this using of the triturations instead of the tablets, the lower potencies will be more beneficial, because during the process of this conversion of these powders into tablet, they may add some gum or some heating process are going on. So that will further deteriorate the power of medicine. So when you give always the lower potencies, the triturations, give it the powder form. That is suggestions made the last day. The Dr. Nithya might have missed that. Okay. Anyway, this is a nice presentation, and also we must think about this, the problems created by this use of the social media, and how, what about the impact, and what is the role we can be played, or homeopathy, how it becomes instrumental in solving the problems created by this social medias and mobile phone. That is the most important thing, Dr. Nithya.
Yes, sir, sir. Because you see, but there is in psychology one term again raised, that is social media syndrome. Social media syndrome.
Yes.
That means if our friends and colleagues say is putting a new car, standing with the husband, standing with the family, and putting photos from a world tour and all that, that makes a lot of ladies sleepless, and it is creating a lot of problems. But the person is not identifying that such a lot of problems are going on there.
Yes.
So without a thyroid or something just like that, no ladies can go on smoothly.
Yes. The television serials in aged patients, the cartoons in children, and the mobile in the younger ladies. These are the three pillars, I think, for all the social stigma or problems created in the recent days. Moreover, the patients, they are always watching all these things, are often trained to imitate or to act. They know how to act. That's the most important thing that often creating problems to us. We feel she's a pulsatla, she's a natramur or a carcinosin or very gentle, mild, timid, yielding disposition. But what is, in fact, she may be a capsicum. Yes, it is a devilishness. As a Beckend. So a lot of this acting process is going in our society. That will always creating problems, or in fact, get menace to our profession, because we are always depending upon the patient's emotions, the body language, the expressions. Well, these are only often pretensions.
Yes, sir. Also, what happens that the usual problem, the most important thing that what is happening is that nobody can appreciate another person. That is a very difficult problem going through. In the society, nobody can greet another person. Nobody can clap to another person's hike. What they do is that they will stand as in the social media, if you're putting a picture or something like that, no likes at all. And nobody is responding in the group. It's creating a lot of hurt and mental problems to a lot of persons. Better stay back from the social media is a very good thing.
It's an era of mummy and me's culture. Only mummy and me is the world. That's a problem. And they are creating all the problems. Then they pretend that they are the sufferers. That's another thing. So we must discriminate who is real culprit. That's a very difficult problem for a homeopathy physician. That's most important. Dr. Gauri raised the hand. Dr. Gauri, you can unmute and ask. Yes, Dr. Gauri. Only 1 minute remaining, please. Yes.
Good evening, doctor. Now, Manoj doctor said that Manoj doctor said that there is a acting is taking place in our consulting room, or whether it is. How can we differentiate their acting, or how can we differentiate the real personalities? Because it is very important for us to give the medicine or find the constitution. How can we differentiate whether they are acting, or how can we find the real personality?
Yes, Dr. Nithya, please. Yes. Yes. How can
how can we differentiate? How can differentiate how whether they are acting or they are?
Doctor. Let me answer.
Doctor,
that we will get only through our practice and experience. Only we'll get that. Because if a person or if a lady is coming to us and sitting and just started weeping, don't go to Pulsatla or Natramo. So we should go with first sitting or first sitting with the patient. Don't give a drug which is deep acting. You just give an acute drug or something just like to follow her, become a good friend of her.
Yes.
And after 2-3 sittings only, just give the correct medicine. Other than before that, we do just give an acute drug. Don't give a chronic drug suddenly on first sitting itself. But usually in OPs, what happens is that we'll get the patient only for one time. And what happens is a lot of patients are coming. So we'll suppose we'll miss the patient. Next time we don't get the patient itself also. In that case, what we can do is that you just make our attitude towards the patient, make them pull towards us to the next time.
Yes.
Yeah.
Okay.
Yes.
Yes, Dr. Gauri, you can express a lot of thanks to Dr. Nithya, please.
Thank you, ma'am. It's a very good section, and you are such an inspiring for me, like a beginner. I'm a beginner, and I am running a clinic in Naduamur, Pravachambalam area. You are in the Atakada. Okay, I am seeing in second time. I am seeing you are in the session, and you are inspiring us. You are all inspiring me, like doctors. Thank you, doctor, and
Yes.
Thank you.
Okay.
Thank you.
Well, that is also inspiring to us because we are in the screen for the last 945 days. It's very interesting to hear from you, like the feedback. With that remarks, let me conclude today's session. Hope you to meet the same time tomorrow. Till then, goodbye. And it is all Dr. Thanesh for a continuation program in Malayalam. Thank you.
Thank you, Dr.